So what can we do to improve the quality of care for all cultures? First, we can learn about the main cultures of the population your facility serves. Secondly, we can learn how to solve problems before they get out of hand. One of the complaints voiced by patients and their families is that healthcare workers would rather ignore or minimize a problem rather than deal with it. This perception is partly due to the fact that we don't always have the time to resolve every issue at the moment the patient wishes. On the other hand, if we're honest, sometimes we can fall into thinking the problem will go away by itself, or we tell ourselves we'll deal with it later, or that it's someone else's responsibility. Unfortunately, not addressing problems early usually leads to more problems. This patient has been called from the emergency department waiting room and given a bed in a hallway of the ER, which is very busy with every room taken. The family of the patient doesn't understand why they have to wait in the hall, and they weren't told the reason by the triage nurse when they first complained. They feel like they are being discriminated against because they are poor, and they begin to loudly complain. When the triage nurse walks by again, the family angrily asks to be put into a room. The busy nurse ignores them and goes on with her work. The family gets angrier and louder, causing other patients nearby to become more anxious and upset themselves. What could have happened differently? If the nurse had patiently explained in the beginning why the family had to wait in the hallway instead of ignoring them, the family likely would have settled down, and they and the other patients nearby would have had a better experience in the ER. One lesson from this scenario is that people need to be seen and heard, especially in a situation where they are afraid and anxious. The second lesson is that resolving issues when they arise keeps them from getting worse. In order to problem solve effectively, follow these basic techniques. Gather information. Assess understanding. Give explanations, not orders. Be sensitive to the patient's situation. Summarize and explain the next step. One goal when gathering information is to ask questions so you can get down to the real issue. Another goal is to show respect. Take the attitude that you want to help the situation and be careful not to sound accusing. There's a big difference between
"What seems to be the problem here?"
and
"I want to help. What's going on?"
Listen to the responses you get without judgment. You may not see things the same way, but how the person views the situation is their reality, so don't correct their impression. Be careful not to think that your way of life is the only way. Most people naturally think their way of life, their beliefs and values, are better than other people's. If each of us thinks that our way is best, we'll have a lot of confrontations and misunderstandings. The goal should be to look at other people's beliefs and values as different instead of not as good. This is especially important to remember when faced with a patient's beliefs and values that you just can't understand. For example, when a patient tells you his illness is a result of someone putting a curse on him, what goes through your mind? Does our preconceptions help the patient's health care? No. In fact, they can lead to less than the high-quality care we want to provide all of our patients. Here are some other guidelines for showing respect when interacting with the patient. When first meeting a patient, err on the side of being more formal rather than more casual. Use the patient's last name, introduce yourself, and explain what your responsibilities concerning the patient are. Be caring and try to remember that most patients are scared, anxious, uncomfortable, or in a lot of pain. Understand that many cultures place a high value of input from the immediate or extended family, so try not to lose patience with the number of family members who get involved. Be aware that some patients may find it very important to have people outside of the family, such as elders or healers, be involved in their health care. After gathering information, make sure to document any important information in the patient's chart to share with the rest of the healthcare team. For example, if you learn that a female patient's culture does not allow men aside from her husband to touch her, make a note on the chart so the same problem doesn't keep occurring. Communication is often the most significant issue we face when treating people of different cultures, because misunderstandings between the patient and caregiver can lead to prescribing errors, inability to follow treatment regimens, insufficient pain relief, misdiagnosis, as well as patients just being offended. Therefore, it is critical that you assess whether the patient understands you and that you understand the patient. Even if you speak the same language, your patients, even highly intelligent ones, can have a hard time understanding you if you use a lot of medical terminology or if you have a strong accent. Speak clearly and keep explanations simple when talking to any patient. Also remember that pain, confusion from medications, and general fear and anxiety can make it difficult for people to understand you. Use active listening to check for understanding. This means focusing on what's being said and then rephrasing back to the person in neutral, simple terms what you've heard to make sure they agree with your interpretation. Politely ask the patient to repeat back to you what you've said. If you notice there is a language barrier, get help. Use a trained and certified interpreter. If one is not available to be physically present, the next best solution is to use a trained and certified interpreter through the phone system. The following are some guidelines when using an interpreter. Whenever possible, use an interpreter of the same gender as the patient. Keep your focus on the patient, not the person translating. Try not to use family members or friends as interpreters for several reasons. In many cultures, it is disrespectful for a younger person to communicate information to an older relative, and the healthcare information may be inappropriate or frightening for the child to know. Using family or friends is also discouraged because they may include their own opinions, or they may leave out or misunderstand information. When was the last time you were satisfied with the answer, "Because I said so"? You probably didn't like it even when you were a kid. Your patients don't like it either. When there's a problem, patients don't want to be sternly told the way it's going to be. They want an explanation. So avoid giving commanding statements and give explanations instead. This Indian family doesn't understand why they can't bring food from home for their relative who has had abdominal surgery. The nurse simply and firmly states it's not allowed. When the family sees that the patient is allowed to eat Jell-O, they assume it's now okay to bring her food. The patient eats solid foods before her body is ready and has complications that increase her recovery time. Explanations do not have to be long and detailed, but when patients and their families know the basic reason for what is going on or what's being asked of them, they are more likely to work with you and not against you. So if they have questions or show resistance, you have an opportunity to clarify or discuss the situation before a misunderstanding may occur. We all know it's not fun when we think patients or their families are being difficult or unfair, especially when they don't understand what we go through every day. But in reality, it's not our patients or their families' job to understand us and make sure we feel okay. Their job is to take care of themselves and do everything they think they should to help themselves or their loved one. We can all identify with wanting to protect ourselves and our loved ones. We would do the same. In fact, many of us have done the same thing when we or a family member were the patient. You should also keep in mind that you might be quite comfortable in a healthcare facility, but for most people, it is a scary and mysterious place. This fact alone can cause people to act very differently than they ever would if they were in a familiar environment. So when patients or family members become rude or angry, remind yourself that the underlying reason is usually a misunderstanding or just plain fear. Try to get to the bottom of the issue by gathering more data and explaining rather than demanding. Remember that patients and their families are partners in their medical care, not just receivers. Once you understand that a patient's or a family's goal is not to make your life difficult, but to do the best they can to cope under the circumstances, then it will be a lot easier for you to resolve issues in a calm and respectful manner. You may have no intention of leaving your patient hanging, but if you leave the room without telling them what you plan to do next, they may think you are no longer working on the problem. This could make them feel abandoned and dismissed, which only increases tension. Before you leave the room, summarize what was discussed and let them know the steps you will be taking. Even if you don't have a solution to the problem, let them know the steps you'll take to work on it.